Hey friends, welcome back to the channel. In this video, I look at practical policy analysis. I do a policy analysis myself in real time with mistakes. It's a first cut, quick scan with 10 simple steps. I analyze the World Health Organization's Mental Health Action Plan 2013 to 2020. There are though a few things to keep in mind about policy analysis and this video before we start. First, policy analysis is not easy and takes time and effort, whether you're experienced at doing policy analysis or a student or trainee just starting out on their first, second or third policy analysis. There are though some straightforward, simple and systematic steps that we can all use to analyse any kind of policy, strategy or plan. This is what I'll be showing you in the rest of this video. Even though this is a quick scan, it took me 2.5 hours to do. It went by so fast, I thought it was more like an hour. The second important thing to keep in mind is that policies, strategies and plans are made for an expert audience. Yes, even though we can all read it and it's meant for the general public to also look at, firstly, there are technical jargon words related to the policy area that we will need to research and properly understand. We can do this in the deeper scan, the fine cut. Secondly, we will need background knowledge and information about the country and how government and public services work in that country. Or, if it's an international policy, strategy or plan, we will need to understand how international agencies like the World Health Organization, the United Nations and development banks work with national governments and international NGOs. We will need to do that in the second part of the analysis, which is the fine cut, the deeper scan. So don't get disheartened or frustrated. We can all do policy analysis. You can do policy analysis. And the more effort you put in, the better your analysis will get and the better your analytical skills will become. Moving on to something to keep in mind about this video. Because it's real time, I've made mistakes and some things I could have explained more clearly, I haven't, and therefore I have needed to highlight and amend things where I can. So hopefully what it'll show you is that even an experienced person like me can make mistakes in their analysis and find it difficult to summarize in my own words and difficult to explain things as clearly as I'd like to. In that sense, this video is very real. The color has also been enhanced in this video to make text easier to read. So you'll notice that some parts might look odd. For example, the front cover of the plan. Lastly, I have also put links and information in the description below this video to the plan document and the 10 policy analysis steps and the mind map, as well as some videos on policy analysis that I've already developed and that are already on this channel. I hope that you enjoyed this video as much as I've enjoyed making it, and if you do, please like it, leave a comment and subscribe to the Science and Art of Public Health. Cheers. Today I'm going to talk about practical policy analysis, how you can in 10 steps do a quick scan of any type of policy. Now the thing to remember is that not all of the analysis that you're going to do will be useful and some of it you may throw away. But the approach to analysing any policy that I'll present here will help you to be systematic, analytical, skeptical and reflective of the whole policy document and the policy process. Now these questions are really simple to present and lay out here, but they do take time and effort to do well. My first key point that you need to remember throughout this video is that there are many levels of analysis that you can do. You can go deeper and deeper and do a very in-depth analysis at various levels. For example, using filmmakers' language, we can talk about doing a first cut analysis, a fine cut analysis and a final cut analysis. And what this means is that in the first cut, we do a quick scan of just the document. And then we move to the fine cut where we look at other policy documents, maybe past policies on the same topic and other policies that are related to the policy that we are interested in, as well as looking at the wider context within which the policy was developed and implemented. And then following that, we can do a final cut. And then the final cut is where we bring the first cut and the fine cut analysis all together and create a coherent understanding of the policy process, the policy document, and the wider context within which the policy was developed and implemented. When we talk about the quick scan, we can also do a 3-level analysis. We can look at the factual content of the policy, the explicit, obvious stuff, the stuff that is written, and that is a type of content analysis that you can do. And then we can also then move to a second level, a more deeper analysis called a discourse analysis, where we look at what is meant behind the content. What is the hidden meaning? How was it written? Why was it written in the way that it was? And then lastly, we can do even deeper discourse analysis where we look at what was not said, what was missing from the document, and why was that missing? Why was it not written? Why was it left unsaid? Let's move on and let's start the policy analysis to doing the first cut quick scan 10 steps of analysis. Let's start with the front cover and the back cover. If we look at the front cover, what is it telling us? Well, it's telling us that this is an action plan, which is like a strategy, which is like a policy. So one of the things to remember is that there are often different words used for policy. Sometimes they're called strategies, sometimes they're called plans. Now, often there is a hierarchy. Policies tend to be very general, very vague. They tend not to say things in a lot of detail. They don't give a lot of specifics. And then strategies build on the policy and often give more detail. And then the plan is the actual how we're going to implement it. But in this context, there isn't a separate policy or strategy, so we're going to use the action plan as the policy that we're going to analyze. And we can see here that the policy is for 2013 to 2020, and if we count up 2013, 2014, 15, 16, 17, 18, 19 and 20. So that's 8 years. So it's an 8-year policy, and you'll see that most policies, strategies and plans are for between 3, 5, 8, 10 years long in terms of their implementation period. And that's because they're trying to do very difficult things. It's not going to take a year or two for these things to be achieved and for the policy to be implemented. Now we can see here that it's the World Health Organization that has developed this policy. That's the 2 pieces of information we get from the front cover. Now let's look at the back cover. What do we get from that? And at the top, we've got the Mental Health Action Plan's goal is to promote mental well-being, prevent mental disorders, provide care, enhance recovery, promote human rights, and reduce the mortality, morbidity, and disability for persons with mental disorders. Now that's a lot there, and in fact that looks to me like it's the vision. We're going to come on to it later, but essentially they've given the vision. They call it a goal, but it's the vision, the mission, the overall aim of this policy. I'm actually wrong here. This plan has a vision, a goal, and objectives, as we will see later. And what's the goal? Let's break it down. So we've got here, and I'll use my highlighter. No, I can't use it. Never mind. Here we've got promote mental well-being, that's 1. Prevent mental disorders, that's 2. Provide care, that's 3. Enhance recovery, that's 4. Promote human rights, that's 5. And reduce mortality, morbidity and disability, and that's 6 different elements to the goal that we have. You could break the goal then into 6 objectives. Again, this is a mistake. These are not objectives. Yes, they could have been, but actually the objectives are very different from this. What I'm really talking about is there are 6 parts to this goal, or 6 aspects, 6 things within that goal, which is a bit odd because goals tend to be a single thing, but this has 6 parts to it. Promote well-being, which is essentially people are well and you want to improve their well-being and happiness. Prevent mental disorders, that's preventing people from getting mental illnesses like depression or schizophrenia or anxiety disorder or any other type of clinical disorder where they may require some kind of medical or psychiatric or psychological treatment. We then move on to provide care and enhance recovery, and that's for people with existing mental disorders, mental illness, and mental health problems. And then it's promote human rights, which is, I think, an interesting one. It's interesting that they've put it there as the 5th item. You could put it earlier or maybe put it last as an important thing that you want to highlight. And then lastly, it's about reducing deaths, illnesses, and health problems, and long-term chronic disabilities for persons with with mental illness, mental health disorders, mental health problems. Okay, and then we've got address here at the bottom, and that tells us which department may have written it. It's the Department of Mental Health and Substance Abuse at the World Health Organization, and it's their headquarters in Geneva, Switzerland, that have developed it. And there's a Twitter hashtag and a Facebook hashtag, but they're general WHO hashtags, so they're not specifically about this policy. And then they've got a link to a webpage about mental health, which again we can follow up, not in this analysis where we're just focusing on the document, but maybe this is something that we should write down and put in our notes for the next level of scan that we could do, the fine cut, the deeper scan. Okay, so let's look at the picture now. So looking at the image, we can see that there's a wall and it's pockmarked. Now here, one thing to say is please pause and answer some of these questions yourself. Try and use it as a way of thinking about what you would do and how you would answer the question. So it's a good opportunity for you to pause when I ask that question and then to listen to what I think about this policy. So it's a young girl. She's from an African Caribbean background, from her colour and her hair, and so it looks like a low middle income country. It could be Africa, could be also the Caribbean, we can't really tell. So the implication is perhaps, I don't know, we'd have to look at the document, that maybe mental health issues in Africa are a bigger issue than perhaps elsewhere in the world. Now it could also be that it's just a nice picture, the young girl's smiling nicely, she's pretty, so it's a nice front cover, attracts you to want to read the document. Now if we look at the back, there's not much in the back, it's simply the other part of the wall along which the young girl is standing. Okay, so there's not much coming out of the front and back covers. We know the name of the policy is about mental health. It's the Mental Health Action Plan, and it's over an 8-year period, 2013 to 2020. And on the outside, they've told us the overall goal of this policy, and it's 6 things: promote well-being, prevent mental disorders, provide care, enhance recovery, promote human rights, and reduce the mortality, morbidity, and disability for persons with mental disorders. Now, there is another level of analysis we can do now that we've had a bit of time to think about this goal, is that the public health parts, the prevention parts, promoting mental health and well-being and preventing disorders comes first, and rightly so, but there's only 2 parts to that. The other parts focus, including the one about human rights, focuses on care and treatment and support of people with existing mental health problems, mental health disorders, providing care, enhancing their recovery, promoting their rights within the healthcare service, the mental health care service and the wider health service and social care service, and reducing the mortality, morbidity and disability for persons with mental health disorders. So most of this goal is aimed at people who have mental health issues. That could be one issue that we could take up in our analysis of this policy document. Okay, let's move on to question 2. Question 2 is, let's look at the copyright information. So in here you can see first page, second page, and here we are, third page or the fourth page if we count the front cover. There's something interesting here. They have 4 keywords or key phrases here, and I've highlighted them here. I'm just going to make it a little bit bigger so you can see what I'm looking at. You can see here it says the focus of this in terms of keywords or tags to search for this document, for example, or to categorize and catalog this document. It's about mental health, it's about mental disorders, both prevention and control. It's about mental health services, and it's about health planning or mental health care planning. So that again gives us some information about what the aim and what the objectives of this policy are. You would write that down and have a bit of a think about it. And then if we look, you can see that the document was published in 2013, so almost the same year as the policy was aimed to start. So hopefully it was in the early part of 2013, otherwise we would lose a little bit of time if this was published in the later part of 2013. So we'd only be doing a 7-year policy. Now here it's just about the copyright information, so there isn't anything specific. I'm having a quick scan, but I can't see anything that is relevant to the policy. And then let's move on to the third step. Let's look at the table of contents. You can see the table of contents. There's a foreword, There isn't an executive summary as far as we can see, which is a shame, but that's fine. We can then look through. There's chapter 2, chapter 3, and there's annexes. And you can see here there's about 44 chapters. Now, I didn't do that at the beginning, but altogether there's 50 chapters. I can see here in my document here in my PDF viewer that there are 50 pages, counting all the blank pages and the front and back covers and any other non-text pages that are there. So not a huge number of pages, but a decent number. So what can we see? Well, we can see in terms of the headings, there are only two main headings. It's the actual mental health action plan, and it's an overview of the mental health action plan. Now, overview sounds to me very much like it's a summary, so that might be worth looking at first. So we may look at the foreword and the overview and then go into the details of the policy, because if you look here, the annexes start at 34, the overview chapter 3 starts at page 32, so there's only 2 pages. We can look at that first before we go into the details. So we don't really get anything, unfortunately, from the actual main headings. If we look at the subheadings, the first one we've got is setting the scene, and that is about the background context. And the second one also, if you look, is the same. Same overview of the global situation. But the third one is slightly different. That is the structure of the action plan. So that could be something about the structure or the principles within which the action plan has been created, set out, the recommendations have been developed. And then lastly, we've got another one, and I'll change the color again, the actions, the proposed actions for member states and partners, and actions for the Secretariat. And then fourth, we've got indicators for measuring progress towards defined targets. And then fifth, we have options. For some reason, it's not going to allow me to, I can do it. Options for the implementation of it. So that covers the key things that we wanted to know about. And as I put here, that most policies are broken up into 3 or 4 different types of things. An overview, discussion, or a background context, chapter or section about why the policy is important. And then we move on to something about principles, the framework, the model, the thematic structure of the policy. And then we move on to recommendations for action, and ideally including within that, we also include indicators for measuring progress. And then lastly, there is, though not always, how the plan, the policy, the strategy can be implemented. We do have that in this one. So that's great. There is also a glossary. There's all sorts of World Health Assembly resolutions. That's in the annexes. So it's nice that they've given us the details of what the annexes are about. And then there's some other background material, which includes glossary, links to other global action plans and programs, which is fantastic. That's really good. I'm actually going to change the color of these two. I'm also giving some details about human rights treaties and other materials and resources that countries can use to implement this policy. Now remember, the World Health Organization, because it's an international body, part of the United Nations, its advice and its recommendation and its plans are aimed at country members, members of the World Health Organizations, members of the United Nations. It gives advice to countries about what they should do to develop a national mental health policy, strategy, action plan. Okay, so we've looked at that, and what I've said here is that if you can, you should try and convert these headings into your own words, or to 1 to 2 or 3 word key phrases. Now here there isn't much. I think all we can say here is setting the scene and overview of the global situation. We can actually just call it background context. Here, structure of the action plan, so we can say action plan structure, and then member state actions here, and actions for the Secretariat. So the Secretariat is the people who work at the World Health Organization. It's actions for the member states of the World Health Organization, is actions for international and national partners, or international non-governmental organizations. So what we're talking about is charities, other NGOs that are working across the world. They could be organizations like Oxfam, Save the Children, Red Cross, and all sorts of other organizations that work at international and national level. Okay, I don't think there's anything else we need to look at here. So let's have a quick scan now to go to step 4 to look at if there's any diagrams in this document. Now, it'll be easier if I actually make it a little bit smaller so we can have a quick look. No diagram so far. We can see here that there's some green writing, which seems to be a target, and then there's some actions and actions and actions. There's some very interesting structure of how it's written, so hopefully that will help us to analyze the document. And then we go to the appendix, the annex, and you can see here there are some tables. And so the first table is about one of the objectives of the plan, Objective 1, and here you've got the global target, the indicator, how we're going to check that the policy has been undertaken and been carried out in an appropriate way, and some comments and assumptions. And then here we go on to the second global target 1.2. And then we go on to Objective 2, and there's only a single global target there. So you can see here in this one there's an Objective 1, but there's 2 targets within that Objective 1. I didn't spot that when I was first going through it. There's 2 targets for one objective. Here Objective 2 only has 1 target, Global Target 2, and Objective 3 has 2 targets. Objective 4 has 1 target. So there's 4 objectives. So we found something out from the tables. There's 4 objectives and there's a number of indicators. Objective 1 has 2 indicators and targets. Objective 2 has 1. Objective 3 has 2. And Objective 4 has 1. Okay, so let's move on. And so this is Appendix 2, and this is options for implementation. Again, we can look at that, see here there's some ideas on what governments can do and what options they have to implement the policy, in this case this action plan. So we can have a look at that in detail. That will hopefully give us some further ideas on what we're doing in terms of analysing this document. And this looks like the World Health Assembly. You can see here, you can see the country names here. That's the World Health Assembly making maybe the decision to approve this action plan. And so here it's quite nice. We've got cross-cutting principles and we've got the vision here. So this is the overview. As I was saying, the overview sounded like an executive summary. It was near the end of the document, and then you've got the objectives and targets. We'll come back to this, and that's where the pictures are, the different countries deliberating on this policy. And you've got the goal here of the document, and then you've 3 other things here as well: life course approach, multisectoral approach, empowerment of persons with mental disorders and psychosocial disabilities, and then you've got further things here. So it's a little bit complicated. You've got these cross-cutting 3 principles here. We also have these cross-cutting 3 principles here, because these are cross-cutting, but they don't say that. Because of the way they're written and the design of it, I think that's where you're supposed to pick up that these cross-cutting principles link to this previous page. So even though that heading is not copied onto the next page, I think the assumption is that you will understand that these are also cross-cutting principles that cut across the whole document, all the objectives, the goal, the actions, and the indicators. And you've got some indicators here. We assume that these indicators link to this, but maybe they're more general. Again, we'll look at these in more detail. We're just having a quick scan. And then here in this part of the annex, so there's an appendix and there's an annex. It's a bit unusual to have both, but let's just go back. Yes, so you've got 2 appendices and then you have 2 annexes as well. I didn't really spot that in the table of contents. So I'm just going to have a look at the table of contents, see if that was obvious. Yes, it was. I just didn't spot it. So there's an appendix there, and then there's an appendix there, and then there's annexes there. Okay, that's useful. You can see here, these are the previous decisions that have been made. So this was the resolution of the 66th World Health Assembly, and that probably is this, the images we're seeing here. That's the World Health Assembly meeting to adopt this mental health action plan. And so these are some of the things that were discussed on the 27th of May 2013. And then there's also a resolution in May 2012 on the 65th World Health Assembly about mental health being a big issue. There may be lots of statistical information. I can see some here that might be useful. 13% of the global burden of disease is accounted for by mental health disorders. Looks interesting. Maybe some useful information there. Not sure about some of this. We may need to look at it in more detail. And then we go to the glossary. Here we are. Are there appendices? So I've got to step 5 without actually talking about it, but we've got a sense of it. There's 2 appendices, 2 annexes, and the appendices are quite useful, and the annexes, some of it seems to be useful, I don't know. We need to have a more deeper read. Is there a glossary? Yes, there is, and here it is. So one of the things we need to check is, do we agree with these? Is this the approach you were thinking about in terms of what mental health is, mental disorder is, disability? Is there any assumptions, mistakes, misconceptions that you have, different understandings that you have that don't fit with this? So here, mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. That's the standard mental health definition that the WHO has had for a long time, alongside its general definition of health. Mental disorders, it defines as a broad range of problems with different symptoms, characterized by abnormal thought, emotions, behavior, and relationship with others, and then also saying that it is categorized in a certain way using the international classification system here. In chapter 5, mental and behavioral disorders in WHO's International Statistical Classification of Diseases and Related Health Problems, 10th version or 10th revision. Okay, I'm not going to go into that in great detail, but yes, that makes sense. It's all about mood disorders, schizophrenia, behavioral disorders, mental retardation, so it's learning disabilities as well. I'm unclear about that one. Disorders of psychological development, behavioral emotional disorder. It makes sense. I may not have an exact understanding as detailed as this, but I was thinking that mental disorders meant mental illness and mental health problems that might require some kind of medical, psychiatric, or psychological treatment and support. Disability is about impairments, active limitations, and restrictions on participation. Again, that makes sense. That's my understanding of disability. And what is a mental health policy and mental health plan? A mental health policy is the social statement, or the official statement. That's what it is. OFFI, the FI is missing, is the official statement of a government which defines the vision and details of an organized set of values, principles, and objectives and areas for action to improve the mental health of a population. That makes sense. And if you get rid of mental health, this definition applies to any type of policy. A mental health plan details the strategies, activities, timeframe, and budgets that will be implemented to realize the vision and achieve the objectives of the policy. I've said that you have a policy and then the plan is a way to set out how you will do it in more detail and specifically who will be involved and what they will do. That fits with my understanding, my sense of you have mental health policies, then strategies, and then plans. Sometimes strategies and plans are at the same level. Sometimes strategy is slightly above a plan. And so the strategy is more overarching, and a plan can focus on one element of the strategy, one element of the policy. But that's not the case here, because this action plan is the whole of a general mental health policy. Mental health legislation, that's laws around mental health care services, and potentially social care services. So you've got here mental health day treatment facilities, psychiatric wards, general hospitals, community mental health teams, recovery of an individual with mental health illness. And you can see here a very detailed understanding, but we don't need that. My understanding is recovery is about people recovering from mental illness and then living positive and happy lives without having mental illness or mental health problems again. Psychosocial disabilities, that's not something I've heard before. It's people who received a mental health diagnosis who experienced negative social factors, including stigma, discrimination, exclusion, and people living with psychosocial disabilities, including ex-users, current users of mental health care services. This is a bit more of a tricky one. It's essentially people who have had a mental health illness but also faced a series of issues around the mental illness, stigma, discrimination, and exclusion. And so they've then had further psychosocial issues and problems in managing their mental health problem and in dealing with and getting access to support and healthcare. Now, I would need to have a bit more detailed look at this. I would need to read this paper here on human rights violations of people with mental and psychosocial disabilities to understand better, because I don't have a good sense of what's different about psychosocial disabilities versus having a mental health disorder. What's the difference of mental disorder as defined earlier here, and a disability here? So what's the difference between mental disorders, disability, and psychosocial disabilities? Something I would look at. Maybe it's not directly relevant to the analysis of this policy, but I think it's important just to have that in your mind to say, okay, something I don't understand, it would be good to follow it up and have a look at what is it. So we've gone through the glossary now, so let's see if there's an index. So this is step 7. Don't think there is one from my first pass. No, there isn't one. So there isn't an index. But I think there is step 8. There is references. So there's references throughout, which is a bit of a thing, but let's see, maybe there's links to other strategies, which is nice. So there's links to harmful use of alcohol, but that's a deeper scan. We're going to look at these in the deeper scan. It's making our lives easier, but having it here, it'll find it much easier for us to do the analysis. You can see here that a lot of strategies are involved. Here, I thought this was some references. The other one has a number of synergies with programs. So this is a different program. So this is not a reference list. So they don't have a reference list. I'm wrong. Here, there's some additional materials that might be useful. So there's the Mental Health Action Program that the WHO published in 2008. And there's also another one published in 2010, and then there's a report on mental health and development. That looks interesting. I have to read that one. And there's something around 14 policy modules, interesting, but that's more about health systems, which for my analysis, which is focused on public health and prevention, I'm less interested in. Then there's some material on human rights and law, information surveillance, mental health atlas, that sounds interesting. Emergency mental health, not so much detail. Epilepsy, dementia, alcohol, substance use, okay, interesting, but a bit too much detail. I'm really more interested in a much more higher level. So not a lot in the reference list that I can see, but a few things that I would follow up in the deeper scan. Okay, let's move on. We have already got the goal and the vision. Now we come on to the meatier step 9, which is what I've been hinting at and already saying a few things about. I'm going to go to the foreword. So the foreword is by the previous Director General of the World Health Organization. So basically the head of the World Health Organization wrote the foreword, Dr. Margaret Chan. It's not Dr. Margaret Chan now, it's currently Dr. Tedros. Let's have a read of it, and what does it tell us about the policy and the issues that this action plan is interested in supporting, interested in doing something about and reversing. Mental health and well-being is a fundamental component of WHO's definition of health. Good mental health enables people to realize their potential, cope with the normal stresses of life, work productively, and contribute to their communities. This first paragraph is essentially setting out what mental health is and why is it important. And then that links to the second part of this foreword, which is the second paragraph. Mental health matters, but the world has a long way to go to achieve it. Many unfortunate trends must be reversed: neglect of mental health services and care, abuses of human rights, and discrimination against people with mental disorders and psychosocial disabilities. Now, we've already come across these. I've already said that I wasn't sure about what this meant. You can see that I'm going to have to look at it in my deeper scan. I'm going to have to find out what it means. This first two are setting the scene. So the first one says, good mental health is important because it's part of what health is about. Good mental health allows people to lead good, productive, happy, healthy lives and be positive contributors to their communities. But it also says, actually, we're not doing very well on it. We've got a long way to go. We're going backwards. Unfortunately, many unfortunate trends where you can read that is saying we're going backwards instead of going forwards and things improving, we're going backwards, and we need to reverse that backward trend. And then the third paragraph goes, this comprehensive action plan recognizes the essential role of mental health in achieving health for all people. It is based on a life course approach. If you remember, and maybe I'll point it out to you, we saw this word come earlier. It was in the principles on page 34, 35, somewhere there. You can see here that was the cross-cutting principles, and then on this page a life course approach. That's a really important thing. Mental health is about the whole of life. So across the life course, at conception, during pregnancy, when you're a baby, when you're just born and the first few years of life, when you're a young child, when you're an adolescent, when you're a young adult, when you're a middle-aged adult, and when you're an older person, and then when you're an elderly person. So all of those stages require a life course approach because we're different at those different stages, and the approach we might take to mental health is different across those different stages of life. Then she also talks about achieving equity, and her focus on equity here seems to be around universal health coverage, which is about healthcare, access to healthcare. Universal health coverage is about universal access to healthcare, and she's also stressing the importance of prevention, that we need to prevent mental illnesses. But you can see here that's the third thing. So life course approach, achieving equity in healthcare services for people with mental health disorders, and then lastly, but I think it should be first, prevention. A life course approach to prevention and then a life course approach to supporting people through universal health coverage, and then achieving equity. And achieving equity should be both in terms of prevention, in my opinion, as well as it should be in terms of healthcare access, because we want to support people with the worst situations that they're living with, having support and prevention services focused on them, targeted at them, more than the general population. Now you can see here I'm already starting to do an analysis. I'm already arguing with the text. I'm not accepting what it's saying and saying, okay, that's fine. I'm saying, hang on a minute, that's not how I see it. Now, of course, this skill is not something that happens immediately. It takes time. You need to read a lot. You need to think about it a lot. You need to have read a lot of policy documents. But I think by taking a skeptical approach and reflecting on it, and depending on your focus, what is your focus? So my focus here is I'm interested in public health. I'm interested in analysing this document from a public health point of view. But if I was a healthcare person, a doctor or nurse in mental health care, then I might be focused more on and saying universal health coverage should be the first thing and prevention should be later, because the issues around healthcare are much, much worse. And so maybe we need to sort those out first, and hence they should be the first priority. And maybe that's how Dr. Chan here is looking at it, that healthcare coverage is a big issue and therefore it needs to be said first before we talk about prevention. 4 objectives are set forth. If you think about it, here at the back, we had the goal, and we'll come and check whether that is the actual goal. So this is the goal of the action plan. And then here, now we are getting the objectives. More effective leadership and governance. Okay, so what does that mean? What does it mean by leadership and governance? Governance in what sense? Leadership in what sense? Why does it need to be effective? If it's not effective now, why is it not effective now? So there's a lot of questions in this. It's not just about writing the description. It's fine. At this stage in the quick scan, you can just write it. Yeah, the 4 objectives, and just rewrite it, reword it, put it in your own words. But really what you need to think about is, what does it mean? What is Dr. Chan trying to tell us here? And the second objective is the provision of comprehensive integrated mental health and social care services in community-based settings. Now, I think this one's easier to understand. Yeah, it's saying comprehensive, which is wide-ranging, supports them in all aspects of their life. Integrated, because it's not just healthcare services, it's social care as well. What happens once the people are out, they're on treatment, they're stable, they're happy, they don't need hospital treatment or any in-depth or large level of support from healthcare services, but they do need social care. They need to live in the community, they need support with going out shopping, learning life skills, finance skills, budgeting, how to talk to people, how to engage in social conversation. They may need that kind of support because it may not be so easy for them to come back into community and be a productive member of society. And then the third objective is the implementation of strategies for promotion and prevention. That's not too difficult to understand. It's just about, we need to first of all have strategies for promotion and prevention. So this assumes that there are strategies already out there and we just need to implement them. So it could be that it's talking about this plan, for example, that we need to implement these plans that are like this WHO action plan. But it could be that our country hasn't got any strategies for promotion and prevention because we don't have the money and the resources to be able to think that far ahead in that wider preventative way, because we're having to react and deal with things as they are on the ground. And so our focus is just on supporting people with mental health issues, mental health problems. And then the fourth thing is around strengthened information systems, strengthened evidence, and strengthened research. So there's 3 parts. One is information systems. What's that about? I have a sense of it. So I think information systems is about information systems in health and social care, information systems in the service, information systems at community level, basically understanding what is happening within health and social care. Are we supporting people? What's happening in communities? Is well-being improving? Do we have things like good housing? Do we have things like nice parks and leisure facilities? Do we have safe streets? So this is my sense here, information systems in the round, but particularly health and social care services, so we can track whether people are being supported appropriately. We also need strengthened evidence. So in each country and at international level, we need more evidence about what works, what is supporting people, how can we best support people, what is working for people in terms of supporting them when they're ill, and also preventing mental illness. What prevention strategies and approaches and interventions and actions can we take? And research, that we need to do more research in this area, both on people who have mental health problems, but also the general public, the general population, how we can best support and improve and make people more resilient and more able to cope with the negatives in life, such as, for example, we're currently going through a mini crisis, energy crisis, and so that is creating financial problems and also food issues as well because of the current war in Ukraine, and Ukraine being a big exporter of sunflower oil and wheat and other commodities, and of course Russia also providing a lot of oil and gas, so that is creating pressures on prices of oil and gas and pressures on wheat and sunflower oil and other types of food products. Okay, let's look at the last last sentence, although the targets of the plan are ambitious, WHO and its members are committed to fulfilling them. So that last sentence is quite interesting. Is ambitious. We could read into it, say it's actually quite difficult. It's not going to be easy to achieve. So it's ambitious. On the positive side, it's like ambitious. Yeah, we want to really do well at high level. But on the other hand, it could also mean there's a high likelihood we could fail. So we get to 2020 and we haven't achieved what we hope to achieve. And it will be interesting to do a follow-up video here to look at whether the targets from this action plan have been achieved. Now, there is a new version of this plan out, which has been extended from 2013 to I think 2026. It's worth having a look at after you've had a go at analysing this policy in detail. Okay, so we've got some useful information from this. We know what the overall vision and mission is. That's on the back cover. We know what the 4 main objectives are. We're starting to get a sense of what the principles are, how this policy has been developed using those principles. Okay, we've read that. Now let's go on to the overview. We're not going to read the detailed chapter. We're going to go to the overview, which is like a summary, and that's on this page. A world in which mental health is valued. So this is the vision. A world in which mental health is valued, promoted, and protected. Mental health disorders prevented, and persons affected by disorders able to exercise the full range of human rights and access high quality, culturally appropriate health and social care in a timely way to promote recovery in order to attain the highest possible level of health and participate fully in society and work free from stigmatization and discrimination. We've got a problem here, and the problem is we've got this lovely vision here. I really like it. I think it's excellent. But then what about this goal here on the back? So what's that? Is this goal below this vision? And we may have to point this out as there's a bit of an oddity, a bit of a contradiction in this policy, because on the one hand we've got a vision, and on the other hand we've got a goal. And while they are complementary, they are slightly different. They're emphasizing different things. I think the vision is really overarching. I really like it. And the goal seems to be much more narrower and focus on the actions. But then how does that relate to the objectives? So we have now a vision, we've got a goal, and then we've got 4 objectives below that, and we need to try and understand that. But at least we're making sense now of this document. Okay, then we've got these cross-cutting principles. So what are we doing with these cross-cutting principles? There's 6, aren't there? There's universal health coverage, human rights, evidence-based practice, life course approach, multi-sectoral approach, and empowerment of persons with mental disorders and psychosocial disabilities. Now you can see here, there's a goal here. So one of the things I want to do is try and look at these 2 elements. I'm going to try and see if I can copy this part. So let's look at that compared to the goal at the back. So here it is. Just going to see if I can put the text here that I've just copied. Yes, I can. Fantastic. So here is the goal set out in the overview chapter to promote well-being. We've got that. So if we set it up there, I think that's quite nice. So we've got here to promote mental well-being, prevent mental disorders, provide care, enhance recovery, promote human rights, and reduce the mortality, morbidity, and disability for persons with mental disorders. Fantastic. It's exactly the same. There's no contradictions. Now we can go back up and can say in this document, which is quite unusual, we have a vision, we have a goal, and we have 4 objectives. And these are the 4 objectives. Normally I would check them, but I can see the first one, I remember this one, to strengthen effective leadership and governance for mental health, and I remember this one as well. We can just go back up just to remind ourselves what Dr. Chan said here. She said more effective leadership and governance, provision of comprehensive integrated mental health and social care services in community-based settings, implementation of strategies for promotion and prevention, and strengthened information systems. So for me, the key words that I would take away, the 1 to 3 key phrases, is leadership and governance, provision of integrated mental health and social care services, ideally in community-based settings, of course, but to keep it short, the key thing is integrated mental health and social care services in community settings. If I was going to re-look at this and redo this in terms of highlighting, I'll remove the highlight here. So for me, it's leadership and governance is the first one. integrated mental health and social care services in community settings. Comprehensive we get, providing we get. And here, strategies, implementation of strategies, you can't change that, or you can just say strategy for promotion. What's the difference between promotion and prevention? There is a difference, but in terms of talking about it, it's essentially public health strategies. And then here, it's about information systems, evidence, and research. We probably can't really change that. So let's go back to here, and we can see they're exactly the same. There were 2 targets for objective 1, 1 target for objective 2, and 2 targets for objective 3, and then 1 target for 4. So in this 2 pages perfectly, you've got all the key things around what the vision is, the goal is, and the 4 key objectives, and the 1, 2, 3, 4, 5, 6 target or indicators. We can now write what those are. Now remember, that is really important. You've now got a very good idea of the shape, the structure of the plan. What is it trying to achieve? Now the thing we haven't got is what should we do about it? And I think there's 2 places, if you remember, when we looked at the table of contents. So let's go back to the table of contents and have a bit of a look at what the table of contents was telling us. Here it is. You can see here, we haven't looked at any of this. We've just looked at the forward, we've looked at the overview, we looked at the back cover, and so we've got a good sense of what the overall vision, goal, objectives, and indicators for this policy are. And there's not a huge number of them, which is very helpful. So we can see here, Appendix 1 and Appendix 2. We already know a little bit about indicators. We have very little idea about this. So let's go to this, to page 23, so we can have a little bit of a quick scan before we start reading all the chapters, chapter by chapter, because I think we can get a good idea of what kinds of things are being implemented. Now it's Appendix 2, isn't it? Here it is. Options for implementation. This is it, page 23. So what are the actions? Here you can see the first thing to do is quite a challenging thing. You can see there's an objective and there's an action and then the options. What can governments do? But we need to think of the action first and how they're going to implement it. So there's 2 different aspects to this. So let's just look at the first thing, which is about actions. So because it's a nice table, it should hopefully be easy what the actions are. In terms of the 4 objectives, how many actions are there in objective 1? 1, 2, 3, and 4. And there's 1, 2, 3, 4, 5 actions linked to objective 2. 1, 2, 3, 4 actions linked to objective 4. So let's have a look at what they are talking about in a bit more detail. So the actions for leadership and governance, which I said I wasn't sure what they wanted to talk about. So we want to focus on policy and law, we want to focus on resource planning, we want to focus on stakeholder collaboration, and we want to focus on strengthening and empowering people with mental health disorders. So those are the 4 things, just double checking. Yeah. Okay, so in terms of leadership, what do they want the countries to do, and country leaders, politicians and civil servants and doctors and nurses? Policy and law: develop, strengthen and keep up to date and implement national policies, strategies, programs, laws and regulations related to mental health within all relevant sectors, including protective monitoring mechanisms and codes of practice in line with evidence best practice, the Convention on the Rights of Persons with Disabilities, and other international and regional human rights instruments. Now, being honest, I need to think about this part. There's a lot in there. A way of summarizing the action is we need to have good mental health policies and laws, good practice, good positive, supportive mental health policies and laws. And I'm hoping that here we will get some ideas of what they're expecting us to do. But it's really important to try and think about this and then try and, in some simple summary way, think about it in your head about what that means. Resource planning: plan according to measured or systematically estimated need and allocate a budget across all relevant sectors that is commensurate with identified human and other resources required to implement agreed upon evidence-based mental health plans and actions. So that essentially is a very simple one. We need leadership and governance around putting the money in. We need the political will to say, you know what, mental health is important, we need to fund it, we need to have enough people, we need to have enough equipment, we need to have enough buildings, we need to have whatever we need in terms of resources. We need to budget for it appropriately across all the sectors, not just healthcare and social care, but if that involves education or schools and colleges and universities and also other parts of the public sector, any of those areas where people with mental health issues may come across and need access to services and facilities. And it does actually also include private and commercial businesses as well, supporting those businesses, governments supporting those businesses to support people with mental health issues, whether they're employees or whether they're customers. Okay, let's look at stakeholder collaboration. Again, that's a standard one. You'll see that a lot in most policy documents. Engage stakeholders from all relevant sectors, including persons with mental disorders, carers and family members. So that's really important. It's not just the person with the mental health problem. Carers and family members are also affected, sometimes quite negatively. And they're also very important in helping, supporting the person with the mental health disorder recover quickly and do well and prevent them from having that mental health issue again. In the development and implementation of policies, laws and services related to mental health, or formalized structure and or mechanism. So essentially it's about having a range of different approaches built into the government system that allows a range of different stakeholders to get involved in policy development, law development, service development. I think that's really important. You need to understand what that means. If you can visualize it, imagine yourself being a policymaker and you're doing that. You're going to do stakeholder collaboration, you're going to do the budget, you're going to make sure that there are laws and policies and good laws and good policies that are supportive of people with mental health problems or potential mental health problems. Strengthening and empowering or empowerment of people with mental disorders and psychosocial disabilities and their organisation. Ensure that people with mental disorders and psychosocial disabilities are given a formal role and authority to influence the process of designing, planning and implementing policy, law and services. Now this is really amazing. It's very rare that this is done in most countries, but it's really important that people with mental health problems and their families and carers are given the prime seat. They are the ones that are running, that are influencing the process in a way to make sure that the services meet their needs. And it just makes sense to do so, but it is quite challenging to do that because often the things that people with mental health problems, their families and carers want can be at odds with other professionals, whether that's politicians, whether that's civil servants in government, or whether that's doctors, nurses, public health professionals, social care professionals and others. I thought what we could do is we could do a mind map of this policy and then try and see if we can do it. Now I don't use mind maps as much as I would like to. Let's see how well I can do. Here it is in the middle. It's the WHO Mental Health Action Plan 2013 to 2020. Okay, there we go. And then here, I'm going to talk about the vision. I'm just going to copy it, mainly just for time reasons. I'm just going to make this a bit smaller. Personally, don't like to copy stuff. I'm getting more and more away from that habit because it is much, much better if you can summarize in your own words. Let me actually summarize it. Now, one of the things to remember is, yes, you can switch these words around, but there is a reason why valued is first, promoted is second, and protected is third. So sometimes it's not a good idea to completely change the wording, and then you may put them in quotes if you want, or you just live with the fact that there's a reason for it, and you can talk about that reason, that you have to value mental health first, then you promote mental health in the positive sense of promoting positive mental health and well-being, and then you have to protect it, and it follows that order. So changing it around and starting with protection and then promotion and then value isn't really a good idea. You can do that, but then you haven't really understood the importance of that. So it's a world where mental health is valued, where it's promoted, and so that's one part. If you like, you could actually separate it out, and so let me do that. This gives me an advantage, and we can then take it out. So we can change that and say the vision is mental health should be valued, promoted and protected by all countries and peoples, populations, societies, even better. Okay, so that's there. That's my personal take on it. I'll just say it's in that order. Oops, it's in that order because need to value, then promote, and then protect. Okay, so that's not bad. And then mental health disorders. Mental health disorders or illness. I normally say mental health problems should be prevented. So I would put that there as a separate point and then say people affected by mental health problems should be able to, should have the should have full access to, that's not right, should have access to the full range of human rights. Now, what does that mean? It links to all of the other points that by having this access to, it should then lead to, for me, this is how I would view it, it then leads to the other things: access to high quality, culturally appropriate health and social care in a timely way to promote recovery. And all of that, all of this, well, it's really linking to this group of people. I haven't really changed this because, again, it's quite difficult. These are the kind of standard words. High quality, can't really change that. Culture appropriate, can't really change that. That is the standard way we talk about this. One of the things to watch out for is don't change things for the sake of it. Some words and phrases aren't the words and phrases. Health and social care, can't really change that. In a timely, yes, you probably could change that. But for now, we're just going to leave it and recognize that maybe by putting this in, that I've copied it. Or actually, I can change it now. In a quick and easy way that supports them to recover as quickly as possible and helps prevent future occurrences. So I've added that last bit. It's not in there, but that's what I would hope that health and social care services allow the person to do, to be, achieve the highest possible level of health. Now, that is a standard phrase that you often see: highest achievable, highest possible, highest attainable level of health, and participate in society in as full a way as they can or want to, and be able to work, do paid and unpaid work without experiencing suffering, stigma, and discrimination. Can't really change those words, but the other things you can see I have changed. And the goal is here. Now there's a link between the vision and the goal. There's a hierarchy, so that was the goal. If you look at it, if we break it down, so it's promote well-being, prevent mental disorders, provide care, enhance recovery, promote human rights, reduce. I haven't changed these words. You can see there's a lot of similarities between the vision and the goal. And then we had the 4 objectives. So we've got objectives. I'm not sure we can copy that one, but we may be able to copy the ones at the beginning with Margaret Chan here. Effective leadership and governance, integrated mental health and social care services, community-based care services, so I'm going to just move this a little bit smaller just so we can focus on this. Implementation, implementing mental health promotion and prevention strategies, actions. Okay, and lastly, improve, strengthen is improve information systems, but not sure what kind as yet. So we need to find out what do they mean. Improve information systems, evidence and research in mental health. Okay, so that's the objectives, and then what we can do is we can then link the indicators to each of these. So we can go all the way down to here, just start looking at the indicator or target. I'll just call it both, indicator target 1.1, and it's saying 80% of countries developed, updated if they've already got one, mental health policy plan in line with human rights. International human rights. So that's one. Okay, that makes sense. And actually that is one of the actions, yeah? So the indicators is actually about an action. 50% of countries developed or updated laws, mental health laws in line with international human rights. Okay, that's really quite straightforward. And that's indicator 2, 1.2. Yeah, remember that is objective 1. That's objective 2. And the target indicator, target 2, is increase in health and social care, 20% increase in health and social care for those with severe mental health problems. Okay, and so let's look at 3. So that's got 2, indicator, target 3.1. %, of countries will have at least 2 functioning and working national multi-sector mental health promotion and prevention programs by 2020. I'm assuming they're all by 2020. By 2020. That's probably also by 2020. So they're all 2020, but just worth knowing. Indicator target 3.2, 10% reduction in the suicide rate by 2020. Okay, and then last, 80% of countries regularly, routine is the same as regularly collecting and reporting a core set of mental health indicators. National level, mental health indicators every 2 years through national information systems by 2020. Okay, so we've got that, but the thing we haven't caught, which probably we need to, is maybe it is better to have it at the top, is the principles, which are here. Cross-cutting principles. Principles generally tend to be cross-cutting. They've started with universal health coverage. I might not have, from a public health point of view, I would not start with that. Human rights, yeah, that's fine. I can believe that one as an important one in the top 3. Evidence-based, again, not in my top 3. It's evidence-based practice, and I would be tempted to rearrange the cross-cutting principles by talking about life course approach being the most important one. Then I would put multi-sectoral approach, and then I would put empowerment of people with mental health problems. Now remember I said I wasn't sure what that was, and I do need to, so I'm going to keep that word in there because I'm not sure what that means. So these cross-cutting principles have cut across all the objectives and the actions. One of the things we haven't done is the actions. So the actions are linked to these indicators, we hope. Let's see. If we go back now to where we were, to these actions, let's see if these actions relate to these indicators. It does, because there's the laws and there's policies, and the first one is about policies and laws. So you've got an action around policy and law, and the indicators are linked to that one. And then there's other ones about resource planning action. You can number them if you want. Actually, it might be helpful. I'll do it as 1.1. No, that would be confusing. I'll do them as A. Then action B, so we don't get confused with the indicators. Action C, stakeholder collaboration. And action D, so this is a little bit broader, strengthening and empowering people with mental health problems and the organizations that support and advocate for them, is how I'm reading that. They're not talking about advocacy, but I think that's important. Not only supporting them, but advocating for their rights and their needs. So in terms of the indicators, if you look, the indicators, they do link to these other actions in terms of resource planning and stakeholder collaboration, but they're mainly about action A, policy and law. They're not about any of these other things. They're no specific ones. Hopefully actions B, C and D do feed into policy and law. Okay, so let's look at objective 2, and that's got a number of actions. So that's got service reorganization and expanded coverage. I'm going to put it as reorganization and expansion of mental health and social care services. Okay, we haven't read that, but if we just look at it in more detail now as we're developing it. Systematically shift the locus, the center, the focus away from long-stay mental hospitals towards non-specialized health settings with increasing coverage of evidence-based interventions and using a network of linked community-based. Okay, so service reorganization towards community-based services and expansion, primary care, daycare, support of people, and expansion of these types of community-based mental health and social care services. Okay, I think that's capturing that. So that indicator links to 20% for this. Okay, so that is not directly connected with the main part of this action. It's a little bit unusual. It doesn't link to anything about community-based organizations. We could have a quick look to see if there's anything in the options for implementation that talk about severe mental health. It doesn't seem to do so from what I can see. Okay. So that's a bit unusual. I'm not really sure that indicator is a good reflection of that one. So that's a bit of analysis. I could even put a little note here. Think about whether this is a good indicator for this objective. I don't think it is. Okay, we've done that one. Let's look at the others. That's the first action. Integrated and responsive care. So what does that mean? So let's have a look. Integrated and responsive care. Integrate and coordinate holistic prevention, promotion, care and support that aims to meet both the mental health and physical health care needs and facilitates the recovery of persons of all ages. Okay, wow. I would say it's integrated, holistic and responsive health and social care services, including housing, employment, education and support. Okay, that seems nice. Let's go on to the next one. So this is a very specific one. Mental health in humanitarian emergency. So I'm going to leave that one as in not a critical one. It's very focused on a narrow thing. And then again here, resource planning. So we had resource planning up there and we've got resource planning there. So now I'm going to call this action 1A. This is 1B. This is 1C. And this is 1D, and I'm going to call this action 2A, call this action 2B, action 2C, action 2D. I think there is a D. Yeah, address disparities. Okay, that's very interesting. So one of the questions we have, which I didn't talk about before, was about addressing inequalities. So in this one, there is something about addressing disparities, inequalities, and equity. I think that is a really important thing to be able to do and to look at. And the focus here is on addressing disparities in services, health, and social services. Not in other areas, it seems to be, not in education, employment, which I would have hoped they would have done. So a bit of an issue here. Why not like action 2B across all types of public services? So maybe you could criticize it a little bit. We could have a quick look just to see if there's something here that we haven't spotted. No, it's got some nice groups here, so it does seem okay, but it doesn't talk about housing and other things. So it does talk about homeless people, ethnic minorities, prisoners. Okay, so again, indicators maybe just linked to 2A again, not linking to these other ones. Okay, so let's start with this one. Objective 3, mental health promotion and prevention, including reducing stigma and discrimination, which is an important thing, and human rights violations. That's quite interesting. I think they're talking about universal and targeted approaches focusing on vulnerable groups. So that's one. So that one, probably that indicator links to that one. I'm going to call that action 3A. And let's have a look at the next one. Suicide prevention. We can see that that one relates very closely to this indicator here. 3.2. and then action. Is that 4? Have we already reached 4? Okay, there's only 2 actions here, so just better delete this one. Just to double check that I haven't somehow missed something, I'm just going to check that there were only 2 yet. So now we go on to objective 4 there. Indicator 4 is about information systems, and that one definitely fits into that, so that was quite easy. And then there's a bit about evidence and research, and that one doesn't really fit there. So you can see here, which is quite nice, and I'm just going to save this because I don't really want to lose it. Okay, done. So we've got an overview now. You can see here we've got this vision. Most of it's in my own word, which makes life a bit easier, but I may need to just double check to make sure that I'm using my own words as much as possible. I really like the Zettelkasten method by Luhmann, where he argues for using your own words wherever possible and converting things into your own way of thinking, and that is a better method of remembering and learning. So we've got the vision here, we've got the goal here, we've got the principles here, which I might actually put here. So these things link together. Vision then leads to the goal, which are a bit more practicalizing of the vision that are very similar, and then the principles, which are cross-cutting, which led to these 4 objectives, which have all these actions, which have all these indicators. Now I will link to all these things, the checklist that I'm using, the 10 steps, and the WHO Mental Health Action Plan mind map here in the description below the video, so you can have a look at it yourself. One of the good things about mind maps, which being honest I don't always use as much as I should, is that it can provide you with a linear map where you can go through. Now this is all description, so remember I have been talking a little bit about analysis in terms of what's missing and what I like about some of the things that we're talking about in this document that's talking about objectives and visions and actions, but we haven't really gone to say, and this would be the deeper scan, we haven't gone in to talk about, is this the right vision, is this the right goal, are these the right cross-cutting principles, are these the right objectives, are these the right actions, are these the right indicators. So while I have mentioned here and there things that I like, things I don't like, things that I think are not completely correct, I haven't gone into that deeper level. This is simply understanding it at a descriptive level and then thinking about how you might build on this. I'm just going to minimize this now, and because we've got to this point now, we're going to the next level of detail, which I might reopen this mind map for, but for now I just want to go back to our steps. Now you can see here, what are the key things does it tell us about the policy? So I think we've got a lot of this information. What are the key things does it tell us about the process of developing the policy? Well, we haven't really learned a lot about how this policy was developed. There isn't a lot of information. There is a little bit here. It talks about a request to implement actions. So here it is. There's something about the World Health Assembly was involved in adopting this comprehensive mental health action plan and then urging member states to build on it and to use it and to develop their own national priorities in relation to their national country context, and invites international and national partners to do stuff. So we're a little bit stuck in this in terms of how the policy process worked, and that is often a problem with most policies where we don't really have a good idea of what is happening. One of the things I haven't done, which I should do before I move on to other things, is to do the hard work of going through each of these options and then thinking through how they link to this. Now for this video I think that's too much detail, so what I'm going to do is move on to the other chapters, the things that we haven't looked at. So we look at a little bit of the setting the scene and see if there's anything else that gives us a sense of what we need, because I think otherwise we were going to get bogged down in the detail, and the quick scan is really not about the detail, it's about the high level, just getting an overview, getting a really good understanding of the high level aspects of the policy and not getting too much into the weeds, as it were, the details. We want to see the forest, we don't want to rush in and see the trees just yet. We want to just get an overview of the forest, how big it is, and get a sense of it. We want to get a sense of the policy as a whole. So setting the scene, this is a little bit about the policy process now. In May 2012, the 65th World Assembly adopted a resolution saying that there was a need for a comprehensive coordinated response at country level. So in 2012, the World Health Assembly asked the Director General to develop a comprehensive action plan. I think that was there later in that bit that I was just looking at, but I didn't understand it in that context. But now I'm reading this, I kind of get it. So 2012, World Health Assembly, which is most of the countries, the member states said mental health should be the next area of focus. Director General needs to develop a plan, and so the Director General did that. And then what did they do? Well, they had consultations. We don't know the details, but they had consultations with member states, so countries, civil societies, NGOs and other groups within countries, and then international partners and international NGOs, non-governmental organizations. And then it says it's taken a comprehensive and multi-sectoral approach. Well, that's they're saying that. How do we know that's true? But one of the things is, don't just assume whatever they say. Say, well, how do you prove it that it's multi-sectoral? Prove it that it's comprehensive through coordinated services for health and social sectors, emphasis on promotion, prevention, treatment, rehabilitation, care and recovery. I'm not going to highlight that because I don't need to. I think we've got a good idea already of what the vision, goal, objectives of the policy, the plan are. So it sets out clear actions. Again, we could argue, is it clear? It seemed to be okay, but it seems quite challenging. Again, the actions are for quite a lot of groups. And I'm going to change the color. I think what I'll do is I'll make that green, and that can stay as blue, and proposes key indicators and targets. The indicators are the same as targets. Okay, to evaluate progress. That's fine. The globally accepted principle, the core principle, it's a bit of an odd one in the sense of that's not one of the cross-cutting principles, but no health without mental health is a key principle. So what we could do is go back to our mind map and add this as a principle, and perhaps at the top rather than at there, no health without mental health. Now, what does that mean? That means that we are not fully healthy unless we think about mental health issues. Being physically healthy is not enough. We need to be mentally healthy as well. So I want to try and put that above there. That's it. That's nice. Just going to save that so I don't lose it. The action plan has close conceptual and strategic links to other plans and strategies. As I've said to you briefly before, this is the second stage. The deep scan involves this. So it's really important to look at other plans and how this plan connects to others. We've actually got a little bit of information. The action plan has close conceptual and strategic links to other plans and strategies, what we need for next time, which is great. And it also draws on these WHO regional action plans and other programs within the United Nations. Okay, so that's nice. So we've got some material for next time. Action builds on but does not duplicate the work of. It's meant to be global in scope, so applicable to every country, and provide international guidance for national action plan. And it is meant for all resource settings, low income, middle income and high income countries, and all sorts of government systems. In terms of action plan, the terms mental health disorders means it's giving the definitions here. I'm not going to bother with them because we've already, guess what, looked at them, so we don't need to worry about it because we've already looked at the glossary. Mental health is conceptualized. It's giving a nice definition here. I might still come back to this because there's additional things about children. With respect to children, an emphasis is placed on developmental aspects, for instance, positive identity, ability to manage thoughts and emotions. That's nice. That's building on this definition here that was already there. I might keep that even though we've already seen it back there to say there's two parts to this definition compared to the one in the glossary. Human rights perspective is essential to responding. So this is important. They don't explain why. They don't give evidence. They just say that's there. So that links to one of the principles, cross-cutting principles. So now we get on to the global situation. They talk about health, what is it, how it is. Interesting to read, but it's not adding much to what we've already found out. Determinants of health. So this is good. What are the risk factors? What are the protective factors around health, social, cultural, environment? So it's all of these aspects, but it's very general. We need more specifics. Some groups are more vulnerable. This goes through the vulnerable group. There's a little bit of a talk about disparities or inequalities and equity issues. And then talks about domestic violence and abuse. So I'm reading this very high level. Partly I already know some of this, so I'm just saying, yes, I see that. I'll need to come back to it. At this stage, I can see this is about risk and protective factors. And then also, this is a very important point, a little bit backed up. People with mental health disorders tend to have more disabilities and die earlier than others. And it gives an example of that. One of the reasons is they often commit suicide, which is not a good thing. And often because of the way society treats them and poor access to services and lack of support. And then that makes them vulnerable to committing suicide. suicide. Mental health issues affect physical health, and that's a really important thing. That's what this point is about, that mental health disorders often affect other diseases. Mental health affects physical health, and having a mental health problem will tend to affect the other health problems that you might have. And then here we've finally got some broad statistics. Taken together, mental, neurological and substance use disorders account for 13% of the total burden of disease in year 2004. I would love to have some newer, more recent statistics than 2004. Depression alone accounts for 4.3% of global burden, as the largest single cause of disability, that is particularly for women. So that's a vulnerability, that's an inequality. The economic consequences of that is 16.3 million. In US terms it's trillion, 16.3 trillion, because a million and a million are 12 zeros, and normally we say 6 zeros is a million, 9 zeros is a billion, and therefore 12 zeros is a trillion. So that's a huge amount of cost between 2011 and 2030. That's what we're saying, through lost economic output. Now, I'm not keen on this measure where it's just about jobs and people being productive. That's not the only way to value people. People are inherently valuable, but it's useful in terms of saying that given how much it costs economically, putting a lot of money in is not a waste of money. It's actually very useful and very value for money and cost effective. And remember, mental health disorders also leads to poverty. So there's this whole thing about, if you have a mental health problem, you're more likely to find yourself homeless, more likely to find yourself in prison, and more likely to be marginalized and excluded from society. So it's some good stuff here talking about stigmatization, but again, I'm not going to get into the details. I know what these areas are. You should also have a sense of this, but this is going into the detail. We don't want to go into the detail just yet. Just want to get an overview of this document. Health systems have not adequately responded to mental health disorders, so that's a key point. It links to the points already said earlier in terms of the objectives and in terms of the vision, that there isn't enough treatment services appropriate for people with mental health problems. You can see here it says there's a lack of workers. It says grossly inefficient. I'm not keen on wording like that. There's an immense lack. In some places, one psychiatrist to 200,000 people, that's too few. And that's part of the challenge, that people don't have access because we don't have the expertise. So that's a really interesting point. It's not about access to services because the services don't want you, they're stigmatizing you. It's also a lack of access because we don't have the people. And to train people, remember, psychiatrists, they're doing medicine, that's a minimum 5, maybe 8 years. And then to get to a level where you work, talking about 10 years, where you specialize and stuff. So you have to build in and have psychiatrists now to have enough in 10 years time. And then maybe in 10 years time, the situation's got worse. So you actually need more psychiatrists. It's a really challenging thing. When you look at these documents, think about what's happening here. Don't just look at the surface. If we currently have one psychiatrist for every 200,000 people, say, and we want to cut it down by 10, so we need 10 psychiatrists. For every 200,000 people, we need to train 9 more psychiatrists. That's a lot. You can see here civil society movements are not well developed. Okay, so that's very interesting. It's saying that the NGOs are not well developed and we do need to have more supportive grassroots organizations, charities and others. It's not just about public sector services. It's also about creating that civil society that supports people and advocates for people. Availability of medicines, I'm going to move on from that. And then it's talking about data. There's a lack of data and lack of use of evidence. Data is lacking. Information on what is cost effective and feasible interventions seems to be an issue. And then the Secretariat of the WHO, the people who work in WHO, have provided technical tools and guidance to support countries. Okay, so this is the vision here, and this is the goal here. This is the objectives here, and these are the 6 cross-cutting principles here. But we've already worked this out because we've already seen them through our analysis of the other parts. So we can have a look at them just to understand them better. They're saying no one blueprint for action. You have to develop it yourself. This is just a guidance. You will need to think about how you develop it for your countries. And then here it's quite interesting. It's giving some advice. I'm just going to convert it into yellow. Effective implementation requires lots of partners, and these partners are development agencies, academic research institutions, and civil society. That's family, charities, service organizations, community-based organizations, human rights, faith organizations, organizations. So that's really good. That's about stakeholders and what kind of actors can be involved in the process, both in developing the policy and implementing it and evaluating it. They're saying all these groups need to be involved in different ways. So now we can see that we've got to objective 1 in this chapter. We can see here it's going to explain what each of the objectives has. Now there's something interesting, and we're going to just focus on one objective because it should be the same. You can see here there's a section, there's a number of different points here going from 28 to 34, explaining the objective in more detail. And then you can also see the global targets that we came across before. And then this is the thing that's new that wasn't there before in the tables we looked at. There are proposed actions for member states. There are proposed actions for the Secretariat, and there are proposed actions for international and national partners. And that was something that I didn't really understand when we were going through the objectives previously. And you can see that we're on page 15 here, so we know where we are, and here is page 13. So if we go forward to the tables that we looked at previously, the action tables, you can see here this is objective 1 here, to strengthen leadership and governance, and there are general action here and then options for how this action can be implemented. And there are a range of different actions. There's 1, 2, 3, 4. So then if we go back here, so this is on page 25 here of my PDF, but it's page 23 of the actual document. I'm just going to go to page 13, and that's something to watch out for, that the page number in the document in the PDF can be different to the page number in the actual policy plan or strategy. You can see here page 13 in the PDF, it's actually page 11 in the document. What we're going to do is just have a little bit more of a detailed look at this objective, but really this is part of the deeper scan. But it is important to understand, and the key thing that comes out is that there are actions across each of the areas that are listed previously in the table for the member states, and then there are actions for the Secretariat, and then again the same thing for the actions for the international partners, though actually I'm wrong, it's not exactly in the same format. I don't know why. It seems to be much more general. It's like they didn't want to link it here. And so let's just have a quick look at objective 2 and see if we see the same pattern emerging. So again, you've got some discussion about the actual objective and what it means, and there's quite a lot of discussion here. And then there's the global target, there's only one. And again, you can see here, each of the actions for the member states is across the actions listed in the table that we've already looked at. And same with the Secretariat. Question is it the same thing for the international and national partners? No, they've just got some general areas of work. So that's something we can analyze in more detail in the deeper scan when we look at the content in much more detail. And objective 3, let's have a quick look. Again, yeah, they've got the global targets. They're explaining stuff at the beginning. And then again, member state, Secretariat, international and national partners. And we can probably follow the same thing for objective 4. You can see the details of the objectives are here, the tables that we've already looked at. So we've done a good scan of the whole document. I'm just having a quick look through just to be confident that we've looked at everything, and I think we have. We do need to go through these objectives in more detail, but that we will leave for the fine cut, the deeper scan. So let's recap what we've done. And the best way to do that is using the mind map that I developed, but also to just go through question 10, which I haven't done so far. And so that was about going through chapter by chapter and identifying the aim or the vision and the objectives and the actions that are recommended to be implemented through this action plan by the member states in this case. The thing we didn't look at is inequalities in detail. There was a bit of inequalities. So the one thing we can do is we can type in inequalities and see in what places inequalities is mentioned. Amazingly, inequality, by typing in just INEQUAL, the first part is not there. But inequity is in there. I'm going to look for that. There's 3 places on page 10. Here, where it focuses on the inequitable distribution and inefficient use of resources, which is interesting. And then on page 21, where it talks about monitor inequities and health outcomes, is one of the actions for the Secretariat. And then lastly, one of the global plans mentions health inequities. Just to be sure, let's do equity, EQUI. And so we've got it in a lot more places. So you can see equity is in 4 places. On page 7 here, achieve equity. It's there in terms of the principles of equity, in terms of universal health coverage, and it's there in terms of explicit attention to equity in relation to objective 1. And then lastly, it's there again in universal health coverage in terms of principles of equity. So not a lot of direct focus on equity issues, which is quite interesting. There's a little bit here at the end in terms of the resolution of the 65th World Assembly. No, not here. Again here in terms of C, equitable access, and here and here. Really the same thing, equitable access to services, and that's it. So we have identified all the places where equity is mentioned and we've highlighted them, and we need to look at this in the deeper scan. So what individuals and groups were involved in developing the policy? I said this before, there isn't a lot of information, but one thing we can say is we've already identified that there's member states, there is the Secretariat, and then there's international and national partners, including international NGOs and national NGOs, as well as other public and private sector organizations that could be involved in helping to implement this policy. The other group that was mentioned, if you remember, was early on when we looked at the first main chapter. They focused on page 11, development agencies, academic research institutes, and civil society. So we have got at least 6 key stakeholders that have been involved or could have been involved or likely to have been involved in helping to develop the policy, and certainly are recommended to be involved in implementing and delivering the actions that are listed and presented in this plan. Okay, so let's go to the last part and open our document, and I want to point out a few things. The first thing I want to do is just go through some of this and cut out some of the words. So you can see here it says governments must take the lead. We could get rid of must take and just say governments lead in developing, and we don't need structural aspects, in developing laws, policies, institutions, finances and services, and they must show strong commitment. So have strong commitment and leadership, support and encourage, support, encourage and include NGOs, communities and others involved in all aspects. We don't need all aspects in planning and developing services. We know it's for people with mental health problems, so we don't really need that. And also in prevention and promotion activities, we don't need activities. And mental health policies must be integrated with other policies and actions. We've reduced it so now it just about fits, which is fantastic. We can narrow this down even more. Now, one thing that I missed out was that there is a 2D, which is about resource planning, which I accidentally deleted. So I'm going to put that there, action 2D and then action 2E. So now that's correct. So that was a bit of a mistake on my part. And then we don't have space on this left hand side, though that's where really it should go. We now need to put all the actors that we've identified, the people who are going to be involved, actors stroke stakeholders that we've identified, and that is member states, which are countries that are part of the WHO. They make up the members of the WHO and the United Nations. That's one. Then there's the Secretariat, which is the Director General and the staff, paid and interns working at WHO HQ and in the WHO regions. The HQ of WHO is in Geneva, and there is regional WHO headquarters in Africa, in the Western Mediterranean, in Asia and Pacific, in Europe, in the Americas. And then there's international and national partners, which is all sorts of public sector, private sector and voluntary sector, civil society and NGOs. And then of course they also mentioned, I can add it here, we've got research institutions, We have development agencies like the World Bank, etc. And it mentions civil society, but we've already included it, so we're going to keep it there. It hasn't mentioned all these others, so I'm going to just keep it as civil society, voluntary sector as one separate grouping, because it hasn't mentioned public and private sectors. So that's my idea. Okay, so here's our map. We've got a really good sense now of the plan. We now need to think about it and write it up. Now we can use this as a way of thinking about the plan and thinking about what it's about, and we will have a good first understanding, a first cut, quick scan understanding of what the policy is about. And you can see here there's a vision, there's a goal, there's principles, there's actors, and there's objectives, there's actions, and there's indicators or targets. So that's the core of the Mental Health Action Plan 2013 to 2020. Well, I hope you enjoyed this. I hope you got some useful insights and ideas for when you do a policy review. Well, I hope you've enjoyed this video, and if you stayed this long, please like and comment on the video and what you liked about it. And please also think about subscribing to this channel. And if you have any questions, please put them in the comments and I'll do my best to answer them. Cheers, bye-bye for now, and hopefully I will be able to do another video looking at the second part of the analysis, the fine cut, the deeper scan. Bye-bye.